Welcome to the deep dive. Okay, let's unpack this. Today, we're diving deep into a topic that, well, it affects public health globally, but we're really going to focus on its intricate dimensions right here in India: substance abuse. Our mission really is to get a handle on the community health perspective, understand its true scale, what's driving it, the profound consequences, and maybe most importantly, the sort of multi-layered solutions being put into action. And just so you know, everything we're digging into today comes from the expert community health sources you've shared with us.
That's right. And it's really vital to frame this from the start. Substance abuse, we're talking about the harmful or hazardous use of things like alcohol, illicit drugs. It's not just some abstract global issue the WHO flags. Yes, it contributes massively to disease burden, premature deaths worldwide, all of that. But what's so critical in the Indian context, I think, is that it's not just a medical problem. It's really deeply woven into the socio-cultural fabric. And that means understanding the community dimensions isn't just, helpful. It's absolutely essential if you want any intervention to actually work.
That's a really crucial distinction you make there. And speaking of distinctions, maybe we should quickly clarify some terms because words like substance abuse and addiction, they get thrown around a lot, sometimes interchangeably. So for our discussion, when we say substance abuse, we mean that harmful use of psychoactive stuff for non-medical reasons, something that's bad for your health or how you function. Exactly. Then there's drug dependence. That's more about the whole cluster of things, behavioral, cognitive, physical, that pop up after using a substance repeatedly. And finally, addiction. That's the chronic relapsing brain disorder, the compulsive drug seeking, using despite harm, causing those lasting brain changes.
Precisely. And having those clear definitions helps us appreciate the sheer magnitude of this in India.
Yeah.
Recent estimates, they paint a pretty stark picture. We're looking at over 5.2% of Indian adults affected by harmful or dependent alcohol use.
Wow, over 5%.
Yeah. And for cannabis, it's around 2.8%. Opioids, about 0.5% of adults. These aren't just stats. It's a widespread public health crisis affecting millions. It really demands that community-focused response we talked about.
And that's where, for me, it gets really interesting. Looking at the trends, the demographics, things are shifting. We're seeing kind of worryingly increases among adolescents, among women, and even in rural areas now, which wasn't always the case.
Right.
The peak time for starting. Late teens, early 20s, say 15 to 24. That seems common. And while, yes, it still affects more males, we absolutely have to stress that female substance use is hugely underreported, that social stigma is just immense.
It's a barrier.
And geographically, you see differences too. Maybe more synthetic drugs in cities, while booze and tobacco are still bigger players in rural areas.
And what's truly insightful, I think, is drilling down into the specific substances and their distinct risks. It's not all the same. Take alcohol, spirits, beer, local stuff. It's not just cirrhosis. Think neuropathy, cancers too. Tobacco, cigarettes, beaties, smokeless forms, we know the big ones. Cancers, COPD, heart disease.
Yeah.
Cannabis, bang, ganja, hashish. We're looking at risks like psychosis, serious memory issues, opioids, heroin, smack, codeine, cough syrups, high dependence risk, infections like HIV, Hep C from sharing needles, and overdoses is tragic. Then sedatives, things like benzodiazepines, barbiturates, they depress the central nervous system, and withdrawal can cause seizures. Really dangerous.
Wow.
And finally, stimulants, cocaine, amphetamines can trigger cardiac events, psychosis.
Yeah.
So each substance carries its own unique, often severe health hazard. It really underscores why a tailored approach is needed.
You've painted a very challenging picture there of just the direct health impacts. It really makes you ask, okay, what's underneath all this? What are the deeper forces pushing people towards substance use beyond just saying it's an individual choice?
That is exactly the right question. We have to look beyond the individual to the broader societal factors, the social determinants. These things create the conditions where substance abuse can take root. Things like, poverty, unemployment, substance use can become a way to cope with intense stress.
Like coping mechanism, yeah.
Peer pressure, huge among young people, students. The family environment matters enormously. A background of abuse, neglect, conflict.
Right.
It ramps up the risk significantly.
Right.
Then there are cultural norms. Is alcohol or smoking just accepted, even expected at social events? That normalizes it. Lack of education, lack of awareness about the real risks involved. That plays a part. And even urbanization, easier access, more anonymity, paradoxically, that can increase risk too.
So if we pull back and connect those drivers, what are the big ripple effects? The consequences not just for the person using, but for society?
Oh, the ripples are immense. They touch everything: health, social structures, the economy. It's profound. Health-wise, beyond the direct stuff we listed, think increased risk of NCDs, cancers, liver disease, heart problems, spread of infections, HIV, hepatitis B, C, often through needle sharing,
Yeah.
and the mental health toll is massive, often overlooked,
Valid.
but strong links to depression, anxiety, psychosis, and tragically, suicide.
Mm-hmm.
Socially, the fabric of communities gets torn. Domestic violence, child abuse, families breaking down, homelessness, and crime definitely increases. Theft, assaults, drug trafficking, it's all linked.
Right.
And economically, the burden is just staggering. You've got lost productivity, soaring healthcare costs, and a massive strain on the criminal justice system. It really holds back development.
That's a truly sobering picture of the scale of the problem and its effects. So let's shift. What's being done? What are the key strategies the initiative's trying to counter this, especially at the community level? It sounds like it needs, well, a multi-pronged attack.
It absolutely does. And the approach is multi-pronged. Usually, we think about it in three levels of prevention. First, there's primordial and primary prevention. This is about stopping the problem before it even starts.
Okay, foundational stuff.
Exactly. This includes things like strong legislation. Think the COTPA Act for tobacco control, the NDPS Act for narcotics, even state-level alcohol prohibition. Alongside that, health promotion is crucial. Using IEC campaigns, information, education, communication, mass media outreach, school programs, getting role models and peers involved.
So stop it before it starts. But what if issues do begin to crop up?
Right, that brings us to level 2, early detection and treatment. Here we use screening tools you might have heard of: CAGE, audit, DAST questionnaires. They help spot people at risk early on. Then, things like brief interventions, maybe motivational interviewing by a primary care doc, can help guide people toward support. And for more intensive help, you have de-addiction services. These run through things like the National Mental Health Program, the District Mental Health Program, and critically, through NGOs and rehab centers doing amazing work on the ground, like TTK in Chennai, and Hands in Bengaluru, SPYM in Delhi, just a few examples.
Got it. And the third level then, helping people after treatment, getting back on their feet.
Precisely. Tertiary prevention. This is all about psychosocial rehabilitation, vocational training to help people find work and reintegrate, and crucial long-term psychiatric support, especially if there are co-occurring mental health conditions.
And it sounds like all these efforts, I really need the community to be on board, right? What's the role of the community itself in making these solutions work?
Oh, it's paramount. You need active community participation. Getting local bodies like panchayats involved, empowering self-help groups, engaging youth clubs, making them part of the solution.
Right, not just recipients.
Exactly. And it requires strong intersectoral collaboration. That means police, schools, religious groups, health departments, all working together.
Pulling in the same direction.
Yes. And as you mentioned, the role of NGOs here can't be overstated. They are often on the front lines, innovating, reaching people others can't. Absolutely critical partners.
It's good to hear these local community efforts are backed by bigger national programs. What are some of the key national policies or initiatives driving this?
Absolutely. There are several important ones. The Nasha Mukfarat Abhiyan, NMBA, launched in 2020, is a big one, targeting 272 districts with high rates of substance abuse, aiming to make them drug-free.
Okay.
Then you have the Integrated Rehabilitation Centers for Addicts, the IRCAs. These are funded by the Ministry of Social Justice and Empowerment and provide vital rehab services. There's also the National Action Plan for Drug Demand Reduction, or NAPDR. That's quite comprehensive awareness, treatment, helping people reintegrate socially and economically. And underpinning much of this is the NDPS Act of 1985, which was amended in 2014. That's the main law covering control, regulation, penalties for narcotic drugs and psychotropic substances.
And how do these Indian efforts stack up against, say, global strategies? Are we generally aligned with what international bodies recommend?
By and large, yes. The approach resonates with global strategies from organizations like the WHO and the UNODC. They emphasize things like strong government leadership, big awareness campaigns, using pricing policies effectively for alcohol and tobacco, training healthcare workers for early detection, and really engaging young people. These are all elements you see reflected in India's plans.
Okay, bringing it right back down to the ground level again. What about someone like a community physician? What's their specific role in all of this?
The community physician has a really multifaceted, absolutely essential role. They're an advocate, first off, pushing for better policies and regulations. They're an educator, running those crucial IEC sessions right there in the community. They're a service provider, maybe doing brief interventions, definitely making referrals.
Making connections.
Exactly. And they're also a researcher, often conducting studies like KP surveys, knowledge, attitude practice, to really understand the local situation, who's most at risk. And finally, they act as a coordinator, bringing together different stakeholders, schools, police, local leaders to try and get everyone working together. It's a huge job.
It really sounds like a comprehensive strategy, hitting it from multiple angles. But despite all these efforts, what are the big hurdles, the challenges that still make community control so difficult?
That's a really important point because the challenges are definitely still significant. Probably the biggest is the deep-seated social stigma, coupled with a lack of awareness. It just stops people from seeking help or even admitting there's a problem.
Mm-hmm.
Then there's the underreporting issue, especially the danger and visibility for women. It makes it really hard to know the true scale and tailor effective help.
Right, can't fix what you can't see.
Exactly. And services are often still inadequate, particularly in rural areas. Access is patchy. High relapse rates are also a major hurdle. Addiction is a chronic condition.
Yeah.
And sometimes, fragmented policies or just poor enforcement on the ground can undermine even well-designed programs. So, yeah, lots of challenges remain.
So, wrapping this all up, what we've really explored today is how substance abuse isn't just about an individual struggle. It's this incredibly complex, multidimensional challenge that demands a truly holistic public health response. The solutions, it seems, have to weave together legal action, medical care, social support, education, all with this constant focus on prevention and deep, meaningful community engagement.
Absolutely. And maybe a final thought for you listening. Whether you're thinking about a career in this field or just looking around your own community, understanding these community factors is not just academic knowledge. For future health professionals, it's vital for being effective agents of change. But really, for all of us, it kind of prompts a question, doesn't it? Given how deep these sociocultural roots go, what role could you, right where you are, play? Maybe in fostering understanding, chipping away at that stigma, supporting effective solutions, even if you're not on the quote-unquote front lines. How can knowing this empower you to contribute? Something to think about.